Laura is doing a really fascinating study, because we're looking at, again, a marginalised small group of women, women who have epilepsy, and there will be about 150 of these women who will give birth every year in Northern Ireland. And these women have to take anti-epileptic drugs, and a lot of them then have problems in making decisions about breastfeeding, because they're concerned about the transfer of the AEDs into their breast milk. And there are lots of different AEDs, new ones and some of the older ones. And actually, it's a bit like the older drugs actually don't transfer over into the breast milk, but the new ones do. That's the problem we're facing. So the information that's available for women with epilepsy, it's quite limited. So we are trying to build again a bit of knowledge into that gap, and as I said earlier on, one small pebble in a pond will hopefully do something, will give us some further information. So we haven't, the saliva testing of the breastfed infants in this area hasn't been studied before. And we know that from systematic literature reviews. The decision-making process of these women regarding infant feeding has also not been studied, and unless there's some new evidence that some of the rest of you have found, but we certainly didn't in our systematic review and find anything. So Laura's actually doing quite a unique study, and pushing new frontiers, and we're really hoping that we'll get some good data from this study. And again, it's a small study, it's a PhD study, it's a training programme, it is limited, but it has value, and it has local value. The research will hopefully determine the feasibility of using saliva therapeutic drug monitoring in infants whose mothers are taking AEDs. We're trying to hopefully get this test, do it in the laboratory. We had to design a whole new technique for actually testing it in the laboratory. And unfortunately, our pharmacology person couldn't be here this morning on the team to actually come along and give more information to anybody who wanted to hear more about it. But definitely a new approach, a new laboratory technique has been developed and tested. We don't know, the efficacy of that until we finish the study. But it'll give us insight into the factors which influence. The study will also give us insight into the women's decision making and the decisions, and whether or not evidence and the evidence that we will get from this study would actually have any influence on their breastfeeding behaviour. Because, if you think about it, even if it's only 150 women a year, if those 150 women, even if half of them were able to breastfeed, are able to achieve some of their goal, that would be very helpful. But it is a difficult area. So the progress to date, we've had our first literature review published, the second one's ongoing. We have 19 participants who've been interviewed about their decision making. We have 10 sets of samples that have been collected. She's been collecting the breast milk, been collecting the saliva from the babies, and 4 sets of these, 4 have been breastfed, and 3 babies are due in November 2018. And even though she's on maternity leave, she's still going to go out and get them, because the sample's so important, the study's so important to her. So there's no such thing in our world, a bit like the rest of us, of actually having real time off when you're doing research. I think those of you who are involved know how difficult it is, and when you're getting access to a sample, you have to do whatever it takes to try to work with women and obtain your sample, because certainly in situations like this, it's really, really important. So that's a systematic review. We're very delighted we've got it published, because there was a definite gap in this area, and we've had quite a lot of acknowledgement of that. So